Hi there! Today's topic is questions and answers prior to going to surgery with Dr. Lee. Now, I know that Dr. Lee and his staff give so much information, but we have our personal little jitters and stuff that we get maybe a little nervous. I mean, I know I was. So I have some questions and answers that may help you. Okay, first question. Are you able to see anything immediately following surgery? No, you're not, because you're going to have a blindfold, bandage on your face, and your eyes are going to be bandaged. So that's why you need someone to drive you after surgery. And you wear the bandage for 4 hours, and then the nurse will take it off. Are you groggy following surgery? Yes. Yes, I was, because the anesthesia is wearing off. So you definitely can't drive because you can't see, and then also you're all loopy because of the anesthetics. Did I go alone to and from surgery? Yes, I went alone to surgery. I just went and got a cab from the hotel I was staying at, and the cab dropped me off at Dr. Lee's office. I went at 6:30 in the morning, and then after surgery, one of Dr. Lee's nurses took me back to my hotel. So from surgery, I didn't go alone. To surgery, I went alone. What type of aftercare nurse is required? Now, I recommend Dr. Lee's recommendation of a nurse because those people know what to do. And my girl, oh my god, I loved her. And I was 2 years ago, her name was Jamie, and she was so awesome. I couldn't have asked for anything better. So I would go with one of Dr. Lee's nurses for sure. Then it says, this lady was thinking of bringing her teenage daughter, age 15, but she's wondering if it would be completely irresponsible if she can't see. Would I suggest bringing a grown-up instead? I say the more the merrier, because when you go on vacation, you want a group. You don't really want to be stuck with one person just because they get on your nerves. I don't care who you are, but you know how it is when you go on vacation, and it's better in a group. But no, I think it would be awesome if you brought your teenage daughter, because then you can bond, and she could watch movies in the hotel. She'll love it, and also be there for you. And then if you could bring an adult too, that would be fun because they could drive you to surgery. And I just think it's better to have more people. Dr. Lee said 6 days in LA, and I'm flying from whatever state. In my blog, I thought I went Tuesday and flew out Saturday. I did stay 3 days. If he recommends 6 days, I would go with that. Everybody's surgery is different. Everybody's eyes are different. All of his surgeries are custom, so I would, you can ask him if you could stay less days, but I would follow his instructions. How soon after surgery can you wear eye makeup? If there are bruises, I don't want to look like I got in a fight. Now, Dr. Lee says 2 weeks after surgery, you can start wearing eye makeup. I did it I think a week after. I think the huge thing is infections and stuff, because you want to just take care of your eyes. So, yeah, 2 weeks is safe. If you are very sanitary, maybe you could start earlier if you're brave like me and you want to risk yourself. Just kidding, I wouldn't. I would go with the 10 days that Dr. Lee recommended. Alright. If I had surgery on Monday, do you think I'd be able to go back to work the following Monday? Yes, because I did that, and I had the incisional surgery. However, when I went back to work the week later, the next day I had off because it was a Christmas holiday. So, because I had the incisional method, and then when I'm staring at a computer screen, it depends on what you do, your eyes will get tired. So, just be sure to take it easy and listen to your body. But yeah, you could go back to work a week later, but don't kill yourself, because then your eyes will just get more swollen. But the more you can rest them, the better, and the faster you'll heal. Did anybody ask me rude questions about what had you done following surgery? No, nobody asked me those questions, but they definitely stared at me, and definitely my mom, made some comments and stuff. She's the whole Asian parent thing, that the video I did. But no one outside of my mom said anything. They just kind of stared at me. And I was scared because I think it was Audrey Hepburn or something, like my eyes looked like that. But then I started to think it was beautiful, but they definitely changed completely. So, but now I miss that look. But no, nobody said anything rude. Just the people that knew me just stared at me. I acted like nothing, it's like you can't act like nothing happened, okay? You have to be real. But don't act like nothing happened, because then you're like fake. So, but of course, if you don't want to talk about it, you don't have to. Just be professional at work like normal. Okay, round 2 of questions. The instructions from Dr. Lee didn't mention anything about vitamin C, just no ibuprofen, blood thinners, vitamin E. What does this do, and should I ask him about it first? Vitamin C, oh my goodness, that saved my life, because I took it 2 weeks prior to surgery, and I had no bruising, none, just a little bit of poofiness in my eyes. And I believe it's because of vitamin C. The reason he says no ibuprofen, no blood thinners, it's because if you take like Advil or anything like that, you could totally like bleed to death during surgery. So don't do that, okay? don't die, okay? Next question. I saw some pics online of someone who was really swollen. I'm hoping she just ate really spicy, salty foods every day before and after surgery. The smiley face. Or oh face. In your pics, you looked great 3 days after. I know everyone heals differently based on age, overall health, etc., but could you detail more exactly what you did? Ice a lot through the day, eat really healthfully, drink a lot of water. I want to do whatever I can to get your result after 3 days. Alright, so, what did I do? I didn't ice. I iced once because I didn't feel like it. I should have, but I really didn't ice. I swear by vitamin C. And I didn't eat spicy, salty food every day, but it's not like I ate like organic raw food diet or anything like that. But I ate a lot of plain food like saltines and like bagels, and I did drink a lot of water, and I rested. I think the key is to rest your eyes. So make sure you do the vitamin C to get a similar result to me after 3 days. Did Dr. Lee have you open your eyes during surgery to check how it would look? If not, were you too drowsy? Yes, the whole procedure, I'm opening, closing my eyes. The nurse is there with us. There were 2 and then 1, I think. So 1 nurse and then Dr. Lee, and the whole time open, close, the lights. And I remember how exciting it was when the nurse was like, she was like, yes, or something like that. She made a comment, or she was like, oh, she was so excited that it made me excited. So, that was awesome. I remember that. And I also remember, like, I guess you're not supposed to really remember surgery, but I did. So, but it was a good experience. Do you have small, medium, or large crease? I have a medium crease. Is it an inside or outside fold? I have no idea. But if you do tell Dr. Lee that you want my eyes, he'll know exactly what you want. The inside is supposed to look more natural. I don't know if this looks natural or whatever, but I like this style. Okay. So, am I Korean? No, I'm not Korean. I am a mix of Japanese and Lao. So, I'm half Japanese, half Lao. And I know that Korea is the, like, Koreans have the most plastic surgery done per capita because they're known as for their perfectionist tendencies. So, I love the Asian, the whole eyelid surgery thing. And, so I did want to mention, even though Korea is huge in plastic surgery, I wanted to mention an interesting fact about Dr. Lee because he is affiliated with Seoul National University, which is on the same level as Harvard is in the US, and his title is adjunct professor. So I thought that was a little cool fact that I wanted to tell you guys to finish the video. So I hope you are doing well, and I hope that these questions and answers made you feel more comfortable in going to surgery. Alright, take care, and I'll see you next time. Okay, bye.